To understand healthcare fraud, you must first know the definition of fraud, which is when someone is intentionally deceitful for personal or financial gain. Fraud is a white-collar crime, which is a non-violent crime usually committed by business professionals. In general, healthcare fraud occurs when an individual purposely deceives another party to make money. There are several different types of healthcare fraud with various perpetrators and victims, but it usually involves medical professionals attempting to steal funds from insurance companies. Imagine you've just had a checkup with your doctor, which is covered by your health insurance. You receive an explanation of benefits in the mail, which lists all services the insurance company was billed for. You notice several procedures listed that were not performed during your visit. This is an example of attempted healthcare fraud by your doctor, and the insurance company should be notified right away. A common form of healthcare fraud occurs when a medical provider bills an insurance company for services or supplies that weren't given. Doctors also might perform medically unnecessary tests or procedures for the purpose of billing the insurance company and collecting the funds. This type of healthcare fraud is covered under the Federal False Claims Act, which states that anyone who intentionally submits a false claim is liable for penalties up to 3 times the amount of damages incurred. Let's look at a case study. A dermatologist in Chicago recently was convicted of multiple counts of healthcare fraud. From 2007 to 2013, Dr. Omid Mimar submitted numerous claims to various insurance companies for tests on patients to treat a precancerous skin condition. These procedures were found to be medically unnecessary, and false information was documented in patient charts regarding the diagnosis. Dr. Mimar billed one insurance provider 15 times over a 3-year period when he had never actually examined the patient during that time. Dr. Mimar had faced up to 120 years in prison, but was sentenced in September of 2017 to 3 years of probation in order to pay $150,000 in restitution and a $75,000 fine, among other penalties. Bribery occurs when someone offers money, favors, or something of value in exchange for services or to influence someone. Bribery is also a federal white-collar crime and is often involved in healthcare fraud. For example, medical insurance agents might suggest certain plans to patients in exchange for money, or a doctor might refer patients to a certain specialist that he has an arrangement with. The referring doctor will receive a kickback, which is money or something of value in exchange for the referrals. The federal government has an anti-kickback statute, which states that it's illegal to deliberately offer or receive kickbacks for referrals or services that can be reimbursed through an insurance claim. Let's look at another case study. An anesthesiologist in Dallas recently pled guilty to conspiracy to pay healthcare bribes and kickbacks and other federal fraud charges. Richard Toussaint, along with 20 other co-defendants, operated a medical center that provided various surgeries to patients. Toussaint and his co-conspirators paid physicians to refer patients to their practice instead of recommending surgery at another facility. Toussaint and his team also waived insurance copays or only required patients to pay in-network amounts when they would charge the insurance company a much larger amount. The medical practice also paid bribes and kickbacks to chiropractors for referring patients to their surgical center. The total value of the scheme was almost $40 million. Toussaint was sentenced to 3.5 years in prison in order to pay $7.4 million in restitution for his crimes. Abuse of prescription drugs is common in the U.S. Healthcare fraud involving prescription drugs can be committed by doctors, pharmacists, and even patients. Patients might visit numerous doctors to obtain multiple prescriptions for the same drug to support an addiction or to sell illegally on the street. Pharmacists can alter the dosage or amount of drugs prescribed for friends or family members or steal medication from the pharmacy. Here's an example. 3 individuals in Pennsylvania who operated a forged prescription ring were recently charged with numerous counts of healthcare fraud, obtaining an illegal substance through fraud, possession with intent to distribute a controlled substance, and identity theft. Barry Dorsey, Taisha Dorsey, and Zachary Rathke allegedly forged prescriptions for oxycodone and Percocet using information for actual doctors. This included actual names, medical license numbers, and signatures. The prescriptions were filled and paid for by Medicaid, then the drugs were sold on the street for a profit. If convicted, Barry Dorsey faces up to 60 years in prison and a $3 million fine. Taisha Dorsey and Zachary Rathke could receive 25 years in prison and over $1 million in penalties. Although many cases of healthcare fraud involve doctors and medical professionals, public consumers can also commit healthcare fraud. People often list their friends as family members on health claim forms so they'll be covered under their insurance policy, or add a girlfriend or boyfriend to their policy who doesn't meet the requirements for covering a domestic partner. Let's look at one last case study. In Michigan, a man stole his coworker's insurance information and used it to obtain forged prescriptions for fentanyl, a powerful painkiller. The coworker only learned his insurance information had been stolen when he was contacted by local police regarding the fraudulent prescriptions. The man was caught as he was filling a prescription and pled guilty to obtaining a controlled substance by fraud and identity theft under the False Claims Act. He will serve prison time and must reimburse the insurance company over $100,000. Healthcare fraud, which occurs when someone intentionally lies for financial gain, is a white-collar crime. The most common types of healthcare fraud involve medical personnel billing insurance companies for services or supplies they didn't provide, or performing medically unnecessary tests to get extra money from insurance companies. Kickbacks and bribery are also common in healthcare fraud. Prescription drug abuse is another type of healthcare fraud. Illegal prescriptions can be created by doctors, pharmacists, or patients. Individuals also might steal others' insurance information or lie on forms to cover friends as family.